Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, Cleveland Clinic Chief Medical Operations Officer Dr. Robert Wiley, and for questions, Dr. Heidi Gullett and Director of Epidemiology Jana Rush. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Good afternoon, everybody. I'm here virtually with Board of Health Director Terry Allen and Cleveland Clinic Chief Medical Operations Officer Dr. Bob Wiley to provide you with an important update. We've been fighting through this COVID-19 pandemic for nearly a year and a half. COVID cases are up all over the country. And here in Cuyahoga County, we've been identified as an area of substantial spread of COVID-19 by the CDC. This means we're seeing more than 50 cases per 100,000 people over the last 7 days. Our number is actually around 61 cases per 100,000, up from 39.5 just a week ago. The Delta variant is in Cuyahoga County and spreading at a fast rate. The CDC just said last week that this variant is more contagious than the chickenpox. For that reason, I'm supporting the Board of Health and the CDC's recommendation that residents wear face masks while indoors and near others, whether or not they've been vaccinated. My colleagues in other counties in our state, like Hamilton, Summit, and Franklin, are recommending the same. To reaffirm the importance of this, I'm signing an executive order stating that employees and the public, regardless of their vaccination status, must wear masks in all county buildings effective tomorrow, August 5th. This applies in public spaces, around others, in our buildings. I encourage other companies in the county to do the same to protect employees and customers. Now, look, I know we're tired of this. I'm like you. I'm vaccinated, and I was enjoying getting out without a mask. But now is not the time to let up on our hard work to combat this virus. Last winter, the stay-at-home advisory reduced our COVID transmission numbers, and in the spring, we were successful in slowing the spread to the point that our cases were so low that masks were not needed in most public spaces. But now our numbers are going back up. People are getting sick. People are going into the hospital. We've been doing this long enough to know that wearing a mask works. But the real game changer, of course, is vaccinations. Sure, there are some breakthrough cases. Some people who are vaccinated do get COVID, but it's rare. The rise in cases can be attributed to the fast-spreading Delta variant and a stagnant rate of vaccinations. Vaccines are readily available. They're safe and they're effective. In fact, they're even more effective than the flu vaccine, and they are free. You can find a list of places to get vaccines near you and other helpful resources on our website at cuyahogacounty.us/vax. For your family, for your friends, for your neighbors, for the most vulnerable person that you know, please get vaccinated and please wear a mask. We saw a glimpse of what freedom could really look like earlier this summer. We have an opportunity to get back to that point, but we have to do it together. Thank you. And with that, I'll turn it over to Commissioner Terry Allen to tell us more about the Board of Health's recommendations.
Thank you very much, County Executive Budish. We appreciate, as always, your support from the beginning of this pandemic and your leadership over the last 18 months. And we continue to fight back against this virus as we have from the very beginning. So first, I wanted to take a moment to provide an update on the present situation. Currently, about 55% of all Cuyahoga County residents have started vaccination, and about 51%, just over half of us, have completed vaccination. CDC data also indicate that 81% of those over age 65 in the county have been fully vaccinated, which is very good news. This is important as this age group is most at risk for hospitalizations and fatalities from the virus. Additionally, 62.5% of those over age 18 have been fully vaccinated. As we have since last December, we continue to offer vaccination opportunities for vulnerable populations to protect as many people as we can. This work includes continued outreach in communities of color to provide fair access to the vaccine, as right now, just 33.76% of African Americans and about 45% of Hispanic Latinx populations have started vaccination. We also continue to collaborate with the local foundation community, other government agencies, nonprofits, community health centers, hospitals, and grassroots agencies to spread the word on about as many locations as we can in the community where vaccine is widely available. So, over the last several weeks, the number of COVID-19 cases reported to our office and to health departments across the state has continued to rise, as Executive Budish noted. CDC indicates that we are in substantial transmission, and we did that when we rose above 50 cases per 100,000. And so you've seen those locations, as Executive Budish described, where they've noted that this highly transmissible Delta variant, which accounts for the vast majority of virus circulating in the community, is surging. It has now become the dominant strain in the state of Ohio and across the nation in a very short period of time. We've learned that Delta is more than twice as contagious as previous strains of the virus. We also know that 1,000 times more virus is shed when people cough or exhibit other symptoms when infected with the Delta, potentially exposing others. Consequently, we anticipate that cases will continue to rise. And even more concerning, we also anticipate increases in hospitalizations and fatalities to follow. This is not summertime anymore, folks, relative to the virus. Things are changing. This variant spreads very easily and quickly and presents an increased risk to everyone, especially those who remain unvaccinated. Now, more than ever, it's critically important that anyone who is eligible to receive the COVID-19 vaccine do so. Vaccine is by far the leading public health prevention strategy that can slow and ultimately end the current pandemic. Vaccines are safe and effective and provide protection against variants circulating locally, statewide, and nationwide. If you have been waiting to get vaccinated, now is the time. We urge all Cuyahoga County residents age 12 and older to get vaccinated as soon as possible. And vaccines are readily available through many providers throughout the county. County Executive gave the county website where you can check for availability. You can also go to gettheshot.coronavirus.ohio.gov or by calling 211 to access a vaccine. We're hopeful that additional children under age 12 will become eligible to receive the vaccine as the school year progresses. Now, on the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms. Everyone with a known contact to someone with confirmed COVID-19 disease should get tested 3 to 5 days following exposure. It's also important to isolate if you have tested positive for COVID-19 in the prior 10 days or are experiencing COVID-19 symptoms. So recently, we've all heard about the new CDC research, which indicates that vaccinated individuals can transmit COVID-19 to others if they become infected. Given the significant increase in cases and the new information on transmissibility, the Cuyahoga County Board of Health is providing notice that it supports the CDC's guidance and recommends the use of masks while indoors and near others, regardless of vaccination status, in areas of substantial or high transmission, which now includes, as we've mentioned, Cuyahoga County. This guidance applies to all individuals 2 years of age and older. Vaccinated people who contract COVID can unknowingly expose their kids or other vulnerable family or friends, like the elderly or immune compromised, and certainly nobody wants that. Since children under age 12 are currently not eligible for vaccination, the concern is that the Delta strain will present an increased risk for exposure to these children and those around them. As County Executive Budish noted, we join the urban counties in Ohio that have made similar recommendations to follow CDC guidance, and they're also experiencing substantial transmission. Businesses like Giant Eagle, Kohl's, Target, Home Depot have joined the county and are adopting CDC's masking policy to protect workers and patrons in their stores. This makes good sense. We're glad to see many government buildings that are beginning to now follow the recommendations as well around the community. Masking together with vaccination are necessary now to slow the spread of the virus, to prevent surges in new infections, which could increase COVID-related illness, hospitalizations, and death, as well as stress our healthcare capacity. This is why the healthcare community, including the Cleveland Clinic, university hospitals, and Metro Health Medical Center, support the recommendation for indoor masking for everyone and have maintained these requirements in their facilities. And we'll hear more from Dr. Wiley next on why it matters. Vaccination and the use of face masks are the two best ways to prevent the spread of COVID-19. And some have asked, why should I wear a mask if I've been vaccinated? Consider the vaccine and the mask together to be an insurance policy. The vaccine can protect almost 99% of people who have been vaccinated from the severe effects from the virus. Masks also prevent you from unknowingly exposing someone if you are vaccinated. That's a good way to prevent, if you're not masking, you can infect people unknowingly if you're not wearing a mask. Without these two tested prevention strategies, the cost could be high to you and those you care about who you may unknowingly expose. Those who are vaccinated are at a much lower risk of symptomatic or severe infection that may require medical attention or hospitalization. We know that unvaccinated individuals account for an overwhelming percentage of all hospitalizations and nearly all the deaths associated with COVID-19. As mentioned, healthcare facilities, businesses, and other organizations may require masks to ensure the safety of their employees and customers based on their individual circumstances. So let's talk briefly about schools. Bearing in mind the guidance released by the CDC, we also recommend that all teachers, staff, students, and visitors wear masks when indoors in a school setting, regardless of vaccination status. It's a best practice that can continue to reduce the potential for COVID-19 transmission and other respiratory infections. Remember that flu season is just around the corner, and masks were incredibly effective last year at stifling flu transmission. We saw very few flu cases last year compared to many previous flu seasons. Since the majority of students in the school setting are currently unvaccinated or are not eligible to be vaccinated this time, because they're under the age of 12. Schools should implement physical distancing to the greatest extent possible as well. And the CDC recommends that schools maintain a distance of 3 feet between students. To help keep kids protected in the classroom, schools should layer as many of the established prevention strategies as possible. These include mask wearing, grouping students into smaller learning pods, hand washing and sanitizing, proper cough and sneeze etiquette, improving building ventilation, conducting symptoms and testing as well, symptoms checks and testing, and also staying home when we're ill. K-12 schools are also required to continue to report new cases of COVID-19 to their health department and should identify close contacts as soon as possible to help minimize the potential for transmission to others, especially the unvaccinated. Schools in our health jurisdiction should submit a line list of cases within 24 hours or by the next business day for weekends and holidays for any report of a new COVID-19 case to our email for schools at schools@ccbh.net. We have great respect for our educators in the community and will continue to meet with the Educational Service Center and area superintendents on a regular basis to provide guidance. Lastly, I want to thank our staff who continue to balance COVID response and a wide range of other important public health programs. I'm grateful for their calling to public health service in Cuyahoga County and for all they have sacrificed during this pandemic to serve our community. Please help us to prevent as much additional pain and suffering as possible from the scourge of this pandemic. Get vaccinated and mask up indoors for all of us. Thanks for your time and attention, and now I'll turn it over to Dr. Wiley.
Thank you, Terry. I'd like to just drop back a bit and take a look at the national picture, then the picture for the state of Ohio. So there have been over 35 million people infected with COVID and 614,000 fatalities in the United States. And we're averaging 92,000 cases a day. Now that's up nearly 140% over the last couple weeks. Yesterday in the United States, there were 145,000 new infections. The number of fatalities approaching 400 a day, up nearly 50%, and the number hospitalized is over 47,000. That's up nearly 80% simply in the last 2 weeks. In the state of Ohio, we have 1,132,000 individuals who have been infected as of this morning, and 20,530 fatalities, along with 62,129 hospitalizations. We're averaging about 1,262 cases a day, which is up 140%. But yesterday, just like there was a national high, we were back up to 1,769 cases in Ohio in one day. We have nearly 800 hospitalized, and that's up from 200 cases 4 weeks ago. In terms of the vaccination rate for the state of Ohio, we're up about 49% have received one vaccine, and 46% are fully vaccinated. This is important to put in perspective because some other states which actually have more vaccines have significant challenges now with the Delta virus. Terry mentioned some important consequences of the Delta virus and things that we've just learned from the CDC within the last 7 to 10 days. One of them is how much more infectious it is. It's as infectious as chickenpox. The only disease which we really think about as more infection is typically the measles, but that's more infectious, Delta, than the flu or the common cold or even Ebola type of infections. The other thing we've learned from a study in Massachusetts of over 400 people is that when people congregate in close places, particularly indoors, even vaccinated people can carry the infection. They're usually not very ill, but they carry the same viral load as somebody who's not been vaccinated. Viral load means they have the same ability to give it to our unvaccinated children and anybody else who's unvaccinated. So these are very important concepts in terms of looking at what we're doing. If we look nationally, the states with the highest rate of transmission are Missouri, Arkansas, and Louisiana, and then moving to the east, Florida. We've all heard that the major contributions are Florida, Texas, California, but the highest rate of transmission remains in Missouri, Arkansas, Louisiana, and Florida together. The infection from the Mississippi River that borders these states is moving north and it's moving east. So we've watched it move into Illinois, Georgia, Alabama, coming up to Kentucky, Tennessee, West Virginia, and then we saw southern Ohio affected. Now we're seeing the counties in northern Ohio start to have increased rates of transmission, and therefore the recommendations that were just made by Executive Budish and Terry. So with that, I will close and will open to anyone who has any questions. Thank you.
Thank you all for your remarks. Really appreciate it. We now have a few minutes for some questions. Just a reminder to please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we can take a question.
Hi, this is Anna with IdeaStream. Can you all hear me?
Yes, thank you, Anna. Go ahead.
Hi, just wanted to make sure. So I was just wanting to ask a clarification about this indoor spaces concept of the masking recommendation. So could you just give some examples for people who might be trying to figure out what to do when they're out in public? Like, is this maybe when they're going in a very busy grocery store or like a busy restaurant? Or is this maybe just any retail store that they walk into? I guess, could you kind of explain more about what people should be thinking about?
Sure. Thanks for the question, Anna. I mean, if we go back to when we were wearing masks before, the methods for transmission or the risk for transmission are really no different from way back when we had mass orders in the old days. Now we're past the order stage. We are making recommendations based on where we stand now across the state, and also what's happening in the various jurisdictions. As Dr. Wiley described, we've seen this southern movement, and from the west, the Delta variant is beginning to change the game for all of us. So we know if you are alone somewhere in a workspace, sitting in a cube, and you're in an office all by yourself, there's not a risk there. If you're moving around in a place where you're next to people in grocery stores, up and down aisles, and you're in those crowded spaces, we want you to mask. If you're going to see a concert and you're sitting side by side with someone for over several hours, that's a high-risk situation, and we know really just a 15-minute contact period can pose a risk. This is particularly important given the infectious nature of the Delta variant that we've heard both Executive Budish and Dr. Wiley describe. So we really need to think about that close contact situation and avoid those situations where we could put ourselves at risk, even if we're vaccinated, because it isn't just about us, right? It's about people that we may unknowingly infect if we become infected, given the fact that we know that the viral load, that is, as we're coughing when we're shedding this virus or through some other symptoms, is much higher with the Delta variant. And we are seeing these breakthrough cases, which happen with any vaccine, but we're seeing them with, particularly with the Delta variant. So if you're in an indoor space, office settings, as we've heard Executive Budish note, and even with Home Depot and Target and Giant Eagle and Kohl's and these chain stores are recognizing the fact that it makes good sense to go back to prevention. Those are all retail places. And so they're leading by example, and we would encourage others certainly to do so.
Great.
Thank you. And then just as a quick question about the school recommendations, I was just curious. I know a couple weeks ago, some schools kind of already came out with their mask guidance, and some were like, we can't discriminate, so nobody has to wear a mask, things like that. But with the Delta variant and this increased spread, would you encourage school districts to maybe rethink that and go ahead and require a mask, or what are your thoughts on that?
Right. I think many school districts, and we certainly understand this because we have been, since the beginning of this pandemic, we've been meeting almost weekly. We took a break. It was less than weekly when things cooled down for a while. But for 18 months, we've been meeting essentially weekly with the schools. And so they, of course, are trying to set their trajectories and their schedules for their school year to be able to plan on how they want to address prevention strategies. So we understand many of them feeling that they needed to make some early decisions. What we've seen is a change with this surge and how quickly it's begun to happen. That's what's different. So we meet on a regular basis and have been sharing recommendations for masking with the schools. They have their recommendations that we provided to them, and we're encouraging them to seriously consider that. We know that when we made recommendations, given the moment that schools be remote, we all remember that in order to prevent transmission when we were at our highest and worst point for COVID transmission. Many schools adopted the guidance to be fully remote. Some, about 70% actually did. About 20% of those were hybrid. They were partially remote, partially face-to-face, and several schools decided to go full face-to-face and in person. And so we'll expect to see that there may very well be, based on each individual's district and what the needs may be, there may be some variation. But we think as we watch these COVID numbers, it was important to put the prevention message out from public health that this is the best way to protect kids, particularly given what Dr. Wiley said about what's happening in some of the southern states and the reports about kids being affected and some being hospitalized in Arkansas most recently. So we want people to think about that. We also know that the majority of kids in schools cannot be vaccinated, the under 12 group. So they're walking around, they're not able to be vaccinated. So we have a highly infectious virus that sheds a lot of virus when people are talking or coughing, I should say, or interacting if they're infected. And so that poses a number of risks that we think schools should consider as they look at their recommendations for the fall school year.
Thank you.
Thanks, Anna. Any other questions?
Terry, I can chime in on that last one if we have a second. And that is the people most at risk who are fully vaccinated are the same who are at risk for the initial COVID infection. That is people over 65 years of age and those who are immunosuppressed for one reason or another. So think about those grandparents or those elderly people, aunts and uncles, coming in contact with school kids who may not have much in the way of symptoms, but can shed a lot of virus now. We know this is different from the other types of COVID viruses, the new Delta virus. 1,000 times more viral particles in the airway than the previous virus. So these kids can give the infection to the relatively more susceptible people in the family. So that's really what we're talking about, is not only protecting the children, and increasing rates of infection are being demonstrated there, but protecting their elderly relatives, whether that's grandparents or aunts and uncles, from becoming infected because they're simply more vulnerable to this more aggressive virus.
Thank you.
Thank you, Dr. Wiley. All right, if we don't have any other questions, then that concludes this week's briefing. Thank you all very much for joining us, and we will see you in a few weeks. Have a wonderful day.